And also live with us this afternoon is Bill van Esveld from Human Rights Watch, where he works particularly on the issue of children's rights. Good afternoon to you. Thanks for joining us today.
Thanks for having me.
How important is it that these humanitarian pauses do hold starting from Sunday and that the polio vaccines are distributed?
Well, look, every major United Nations and other humanitarian agency has been calling for a ceasefire to allow them to vaccinate kids for polio. They wanted a week. They're getting, it looks like, 3 days. And I think there's a few things to note here. If the root cause of polio is what we're concerned about, and if stopping the spread of waterborne diseases other than polio, which won't be fixed with a polio vaccine, like we're talking to doctors who say everybody in Gaza has diarrhea, hepatitis A is spreading, people are going to die from things other than polio. So what's the root cause of that, and how do we address it? A ceasefire, a temporary 3-day pause isn't enough. What we need is to see the pressure that's been applied on Israel by its allies for this 3-day pause to be applied to end the siege. I mean, it's a completely unlawful situation where you're depriving 2 million people of clean water. You have rendered all the infrastructure of sanitation, sewage treatment plants are offline, sewage is spreading everywhere. There's no military advantage to that. Denying 2 million people of water and sanitation doesn't help you defeat your enemies. There's really no argument. We need to see an end to that siege. People who try to repair water infrastructure have been targeted. Warehouses full of water repair kit have been destroyed. This is what needs to end so that we can end the disastrous, unprecedented for 25 years outbreak of polio in Gaza.
You used two different words there, the pause and a ceasefire. Now, it's worth reiterating that the Israeli leader, Benjamin Netanyahu, has said this, starting on Sunday, if it does hold, won't be a ceasefire. What do you think about that? And what do you think about the fact that he's given the green light to this? Why has he agreed?
I mean, yes, it's true. In a way, it doesn't matter what we call it. I mean, he's making the point that it's not going to be a permanent ceasefire in any way, that this is only going to be a pause. But, I think to go back to the key issue here, the thing that's driving disease and death in Gaza is the blockade. Coupled with that is the fact that everybody is under, evacuation orders, and they're being pushed into this tiny territory. A leaked U.S. aid memo from Jerusalem a few days ago noted that 88,000 people per square mile is the population density of this Israeli declared humanitarian zone. And these people are just on the sand with no infrastructure, with nothing. That is a perfect recipe for the spread of disease. So yes, any ceasefire, any pause, whatever you want to call it, would be better than nothing, but it's far from enough to address the root causes that are causing people to suffer.
Indeed, as you say, this humanitarian crisis in Gaza is absolutely desperate and will be whether or not this vaccination campaign works out. Look, what kind of pressure and from whom does Human Rights Watch think needs to be applied on the Israeli authorities now to try and secure a more meaningful ceasefire?
What we really need is just for Israel to abide by its international law obligations. By the way, those obligations are really pretty flexible. The laws of war were written by states to allow their militaries to fight. So again, it's not like asking the Israeli military to tie both hands behind its back. It's asking the Israeli military not to engage in collective punishment, to abide by the International Court of Justice's 3 provisional measures, ordering it to open border crossings. And the obvious elephant in the room here is the United States. The United States recently completed its 500th airlift of weaponry to the Israeli military. We need to see that end. There should be a complete suspension of weapons shipments to Israel by the United States and its other allies.
You mentioned evacuation orders a bit earlier on, and we know that Deir al-Balah in the centre of Gaza is under an evacuation order now. It's worth reiterating that had been, until very recently, a hub for the United Nations because they had been forced to leave their earlier hub in Rafah in the south of Gaza. We know most Palestinians in Gaza have been displaced multiple times in this conflict. So what kind of impact, in your knowledge, are these evacuation orders having on polio, but on the humanitarian crisis more widely in Gaza?
So you've got a situation of spreading disease. You've got a situation where we may already be at a tipping point or beyond it in terms of the spread of disease. But at the same time, everything is being made worse when you force people into a tiny territory and you force the humanitarian aid agencies that had been able to deliver at least a little bit of aid to suspend their operations through more evacuation orders. And by the way, those evacuation orders also affected water and sanitation in that area. So even before, when, a few days ago, before these evacuation orders were issued, there was a little bit of water available in Deir el-Balah. That's already plummeted by about 80%. Desalination facilities, sewage treatment plants, water wells, everything has also been forced to suspend. And now you've got a situation where most of Gaza's population is being told to live in a tiny, sandy area with no infrastructure. And an Oxfam report that came out in July said there were 4,132 people per toilet in that area. The people of Gaza have been living on less than 5 liters of water per day on average for 10 months. The minimum in a brief temporary emergency situation for survival should be 15 liters a day. It's beyond catastrophic.
Just one final question for you, sir. I want to ask you about the West Bank. You may have heard our interview earlier with a journalist who's in the city of Tulkarem today. It's the third day of a major Israeli offensive there. I just wonder what Human Rights Watch makes of what we're seeing there right now.
I mean, our concern is exactly what your preview mentioned, that some tactics and the kind of rules of engagement that the Israeli military seems to be applying in the West Bank, it might maybe be appropriate to a total war zone, but that is not the situation in the West Bank. The West Bank is a fully occupied territory. The laws on the use of force there are basically those of policing. So if you want to go after people and arrest them because they have guns or they're trying to kill you, you go ahead and do those arrests. But, we used to be concerned, and we tracked a lot of excessive force by Israeli soldiers using light arms, assault rifles, sniper rifles. Now we've got airstrikes. More than 130 people have been killed in the West Bank this year by airstrikes. That is absolutely unprecedented. Just a few days ago, a man was killed in his kitchen preparing milk for his baby. By an airstrike. He had no connection to anything that the Israeli military was after. And if you start doing airstrikes and applying kind of a laws of war, open fire policy to the West Bank, you're going to see more civilian deaths like this.